introduction, I will be explaining about what is cardiovascular disease. Cardiovascular is relating to the circulatory system, which comprise the heart and blood vessels, carries nutrients and oxygen to the tissue of the body, and remove carbon dioxide and other waste. While cardiovascular disease are conditions that affect the heart and blood vessels, include arteriosclerosis, coronary artery disease, heart valve disease, arrhythmia, heart failure, hypertension, orthostatic hypotension, and shock. There are different classes of cardiovascular disease, and some of them are coronary artery disease, CAD, arrhythmia, aortic aneurysm, renal artery stenosis, cerebrovascular disease, and lastly, peripheral artery disease, or we known as PAD. While the common cardiovascular disease which is frequently encountered by people is arrhythmia, where the rhythm of heart is not steady. Arteriosclerosis, which plaques build up in the walls of arteries, and lastly, coronary heart disease, where major blood vessels become blocked and resisting the flow of blood to the heart. Based on statistic infographic that has been proven by Ministry of Health, over 5.1 million death cases caused by cardiovascular disease. By 1.7 million people in Malaysia currently live with 3 major risk factors of cardiovascular disease, and the other 3.4 million people in Malaysia currently live with 2 major risk factors. While globally statistic infographic shows that over 18.6 million people in global have encountered cardiovascular disease in 2019. The range of cardiovascular disease that was encountered by female was 8.9 million and male range is over 9.6 million.
Hi, I'm Farah Atika and I'm going to talk about risk factors in different gender specific. My first point is hormonal influences. The incidence of non-diabetic CVD is lower in premenopausal women than in age-matched men. Ovarian hormone insufficiency at the time of the menopause is associated with increased cardiovascular events. Thus, CVD develops on average 10 years later in women compared to men. The second one is atherosclerosis is a complex process characterized by an increase in vascular wall thickness owing to the accumulation of cells and extracellular matrix between the endothelium and the smooth muscle cell wall. There is evidence that females are at lower risk of developing cardiovascular disease, CVD, as compared to males. This has led to an interest in examining the contribution of genetic background and sex hormone of the development of CVD. The second risk is on lifestyle factors. Irrespective of the commonly shared features among both genders, the significance and impact of each risk factor varies. Increasing age, elevated blood pressure, high cholesterol, and LDL cholesterol greatly influence men. However, smoking, diabetes, triglyceride, and HDL cholesterol levels mainly affect women. Next, the behaviors and lifestyle contributing to CVD generally include cigarette smoking, a diet high in saturated fat and sugar, and low in vegetable and fruits, as well as physical inactivity and high level of alcohol consumption. For many but not all of these unhealthy lifestyle behaviors, male exhibit higher rates than female. Gender differences in a range of CVD-related lifestyle behavior have been reported across the life course, for example, diet, exercise, and high alcohol consumption. And the last risk factor is genetic predisposition. The high levels of male sex hormone drive down the HDL cholesterol level, with consequent higher early risk of coronary heart disease, CHD. Thus, the gender differences in CHD may well be due to the most basic genetic difference between men and women, which is the presence of Y chromosome. Second point is inherit genes. You could inherit genes that cause heart disease, while there is no single gene that causes heart disease. Several genes can work together to increase your chances of developing it. Certain genes can pass on risk factors such as high blood pressure or high cholesterol. From shared environments can also be passed on to you from the previous generation in your family. You may have developed certain eating habits or lifestyle behaviors such as preference for certain type of food on sedentary lifestyle.
How do specific gender differences in cardiovascular health? The first one is hormonal fluctuations within the human body, particularly in women, exert a profound and multifaceted influence on cardiovascular health. For both sexes, our body produces a few different kinds of estrogen. The type produced by the ovaries is called 17-beta estradiol, which best known for regulating the female reproductive system. Your body converts some testosterone into estradiol through an enzyme called aromatase, so it's present in male bodies as well, just at lower levels, as the testicles also produce small amounts of estradiol. Estradiol performs numerous functions that have seemingly nothing to do with reproduction. In fact, we have estrogen receptors in systems throughout our entire bodies, like in our brains, digestive systems, in skin and bones, and even in our hearts. Those estrogen receptors are picky though. Certain receptors have a natural affinity for 17-beta estradiol, and they're more sensitive to that form of estrogen than other forms of estrogen. Next, how do specific gender differences in cardiovascular health? The second one is lifestyle modifications of each individual's gain increasing recognition as key interventions in preventing and managing CVDs. A heart-healthy diet emphasizes portion control and encourages the consumption of lean proteins, fiber-rich foods, and healthy fats. For example, omega-3 fatty acids like EPA and DHA can reduce the risk of cardiovascular events. Benefits in reducing triglyceride levels, lowering blood pressure, improving endothelial function, and reducing inflammation. Next, example is high fiber diets like in fruits, vegetables, nuts, and whole grains have shown benefits in reducing LDL cholesterol levels, improving glycemic control, and lowering the risk of developing CVDs. The other one is antioxidants like vitamin C and E, beta-carotene, and polyphenols can help reduce oxidative stress and inflammation. Food rich in antioxidants include berries, citrus fruits, nuts, seeds, dark chocolate, and green leafy vegetables. And the last one, potassium and magnesium are minerals that play a role in maintaining healthy blood pressure levels. Physical activities plays a crucial role in reducing cardiovascular risk as it helps lower blood pressure, can lead to a decrease in both systolic and diastolic blood pressure, and improve the efficiency of the heart and blood vessels, reducing the strain on the cardiovascular system. Physical activities have a positive impact on lipid profiles, including reducing levels of total cholesterol, LDL cholesterol, and triglycerides, while increasing levels of HDL cholesterol. Physical activity improves insulin sensitivity, which is important for maintaining stable blood sugar levels. Regular exercise helps the body use insulin effectively, reducing the risk of insulin resistance, metabolic syndrome, and type 2 diabetes, which are closely linked to an increased risk of CVDs. It is worth noting that the harmful effects of smoking on the cardiovascular system are not limited to active smokers. Secondhand smoke exposure, inhalation from smoke from others also poses risk to cardiovascular health. Stress reduction. Chronic stress plays a significant role in the development and progression of CVDs by activation of the sympathetic nervous system, leading to a state of chronic inflammation in the body, dysregulation of the hypothalamic pituitary adrenal HPA axis, changes in blood clotting and platelet function, and unhealthy coping behaviors. It impacts sleep and contributes to psychological factors such as depression, anxiety, and social isolation. There are several techniques for stress reduction that have been shown to have positive effects on cardiovascular outcomes, such as relaxation techniques, regular physical exercise, building and maintaining strong social connections, and support networks, cognitive behavior therapy (CBT), mindfulness-based stress reduction (MBSR), biofeedback techniques that involve using electronic devices to monitor physiological signals such as heart rate, blood pressure, or muscle tension, and providing real-time feedback. And lastly, how do specific gender differences in cardiovascular health? The third one is genetic predispositions to cardiovascular disease. CVD refer to inherited genetic factors that increase an individual's likelihood of developing conditions that affect the heart and blood vessels. Genetics can influence the cardiovascular system in profound ways and affect many of our cardiac risk factors. Family history can be as strong an indicator of heart disease as high blood pressure or high cholesterol levels. However, family history is more than DNA. A family shares a lifestyle and home environment. For example, growing up in a household of smokers or a family that ate a steady diet of fast food meals can influence blood pressure and cholesterol levels. Environmental factors such as air pollution, poor water and food quality, and chemicals such as carbon monoxide can contribute to the development of heart disease.
Next, let's move on to gender-specific in CBD clinical presentation. For male patients with coronary heart disease or CHD show typical symptoms, which are oppressive chest pain, jaw and left arm pain, diaphoresis, shortness of breath, nausea, and vomiting. For female patients, they experience less typical symptoms and more atypical symptoms, such as fatigue, epigastric pain, palpitations, neck pain, indigestion, shoulder pain, right arm pain, and back pain. Men are likely to have obstructive CHD, which is heart attack with severe blockage in the artery, and women likely to have the opposite. Women present with IHD during postmenopausal period, which is or estrogen level starts to deplete. Not only that, male patients with heart failure experience shortness of breath, fatigue, or swelling of the feet, ankles, legs, abdomen, or neck pains. Men with valve disease and IHD experience chest pain. Meanwhile, female patients develop angina as the initial presentation of IHD and are less likely to present with a heart attack. Women with valve disease tend to report dyspnea and exercise intolerance as stenosis progresses. Men with AF or atrial fibrillation are more commonly to be asymptomatic. Meanwhile, women and younger people with AF experience palpitations. Men tend to develop stroke at a younger age. Meanwhile, females are more prone to stroke at an older age. Men with stroke experience more visual disturbance, paresthesia, ataxia, and sensory abnormalities. Females with stroke experience typical stroke symptoms such as facial asymmetry and disorientations. However, they also show atypical symptoms such as nausea and hiccups. It is shown that men experience chest pain and typical CVD symptoms, which can be easily detected, and they will seek medical attention for further diagnosis. However, women experience anxiety-like and atypical CVD symptoms, which shows how unaware they are of their cardiovascular profile, and it takes time to diagnose.
I am Nur Hidayatul binti Muhammad Ibrani. I will explain about how the factors such as hormonal influence, lifestyle, and genetic predisposition contribute to variation in cardiovascular outcome between males and females. Let's begin with hormonal influence. In males, higher testosterone levels increase the risk of hypertension and atherosclerosis by affecting lipid metabolism and promoting vasoconstriction. Additionally, The lack of estrogen reduces anti-inflammatory and vascular protective effects. In females, estrogen protects against atherosclerosis by improving lipid profiles and promoting vasodilation. However, post-menopause, the decline in estrogen levels increase the risk of ischemic heart disease by 2 to 3 times, as it alters vascular function and lipid metabolism. During pregnancy, pregnancy-related hormonal fluctuations, such as those seen in gestational diabetes, hypertension, and preeclampsia, also predispose women to future cardiovascular disease. Next, we will discuss about how lifestyle factors contribute to variation in males and females. In males, the high stress occupation increases the risk of hypertension. Besides, men are more prevalent to smoking and alcohol consumption. Smoking and alcohol use contribute to earlier onset of cardiovascular disease, including coronary artery disease. Additionally, men are less likely to attend routine checkup. And lastly, poor dietary habits combined with high stress level often result in hypertension and myocardial infarction at a younger age. Meanwhile, in females, firstly, higher BMI and obesity rates increase cardiovascular risk significantly, with a 64% risk in women compared to 46% in men. Second, sedentary habits often observed during post-pregnancy also contribute to this risk. Women also experience stress and depression, are at a greater risk of heart failure. Lastly, delayed diagnosis can lead to silent heart disease such as myocardial infarction, which is often overlooked in women. The last factors that contribute to variation in males and females: genetic predisposition. In males, firstly, genetic variations like the APOA5 gene, which affects lipid metabolism, are less impactful in males. However, men with a family history of hypercholesterolemia tend to develop cardiovascular disease earlier due to greater LDL accumulation. Meanwhile, in females, firstly, autoimmune disease and systemic inflammation are more prevalent to women, increasing their cardiovascular risk. Next, women with the ApoE allele are at a higher risk of atherosclerosis after menopause compared to men with the same age. Furthermore, a family history of diabetes impacts women more severely than men, contributing to their higher cardiovascular risk.
To conclude, the result of cardiovascular health may be different between gender. This is also due to the different factors that might affect the cardiovascular health. However, based on our study, it states that males have a higher chance to get the cardiovascular disease than female. This is due to a combination of hormonal factors, earlier onset of key risk factors like hypertension and high cholesterol, lifestyle choices such as smoking and alcohol consumption, genetic predisposition, and psychosocial influences. Type of cardiovascular disease that most common among males are the coronary heart disease (CHD) and coronary artery disease (CAD). To reduce the chances of getting the cardiovascular disease, here are the few suggestions, such as stop smoking, have a balanced diet, exercise regularly, maintain a healthy weight, cut down on alcohol, and prescribe a medicine. Hopefully, by practicing this healthy lifestyle could help to decrease the risk of getting cardiovascular disease and make our life better.